Trauma is the lasting effect of an event or series of events which alters our emotional or physical response to future triggering events, people, things, and indicators that trigger our senses. How we react to those instances is what indicates if we have trauma. Trauma isn't necessarily an event, it's more of our response to that event. It's important I became trauma informed because I believe there's a group of people who do not relate their experiences with being trauma, and therefore they're unable to heal and therefore thrive in life because they don't connect the two, right? So in order to help this demographic of people, I decided to become trauma informed so that I can help identify for them that they may be suffering from some trauma based on their experience. For example, I have sickle cell anemia, so that's a chronic illness that I've been dealing with since the age of 3 months old, right? So there are a lot of things that come with illness that people don't necessarily identify to be effects of the illness. Sometimes we just identify the physical pain as the effects of the illness, but really it can be mental and emotional. Some of these things may include neglect, isolation, grief, even survivor's guilt. Other things that come about from chronic illnesses in regards to trauma are anxiety, depression, feelings of being inadequate, and then insecurities, right? So chronic illnesses sometimes impact our bodies, and our bodies aren't able to do the things that a normal body can. So then we start to feel insecure, and we start to get triggered by the fact that my friend can run and I can't, but we don't realize that we're being triggered. We just know that we get upset and we have this big reaction because, well, why do you want to run? And we have this explosive reaction, and really it's just our insecurities based on our trauma. So that's why it was really important for me to become a trauma-informed coach. And another example, had a client come to me who was really just trying to clear their mind and get their frustrations off of their chest, right? She had recently went through a physical alteration, meaning that she started to suffer chronic pain, and she was not used to this. She wasn't a chronic illness survivor or patient. She just happened to start enduring chronic pain frequently. Now we began our session and we started to talk about things that might be bothering her. But what we came to understand, and as a trauma-informed coach, I was able to highlight that an incident had taken place in her life, which had nothing to do with her physical capabilities, but that incident caused her frustration, anxiety, and it just knocked her off balance, right? And that manifested as pain in her body. So you may be wondering what the difference is between a trauma-informed coach and a therapist or a counselor. And the major difference is that a trauma-informed coach is going to help the client self-regulate their emotions and feelings, and we're going to help you empower yourself to solve the issues and to thrive in life. A counselor may sit with you, go deep into your past issues. They might be able to prescribe certain diagnoses and things of that nature. Being a trauma-informed coach is really a gift to the client so that we can help identify things that you may not recognize, and we can identify it for you and then prompt you to figure out solutions so that you can move into a better phase of your life.